Tip number 7. Choose active contraction rather than passive stretching, since scoliosis posture is a failure of efficient muscle activation. Let's look at the thoracic curve in this image. The muscles on the concave side are relatively shorter than the muscles on the convex side, and the convex muscles are longer and overstretched, yet they feel tight, and all you want to do is bend forward and stretch them. Let's see why that's happening. Muscles on both sides of the curve have a poor length-tension relationship. When they are either too short or too long, they are producing inefficient tension. In particular, the longer convex muscles are constantly producing tension, trying to maintain upright posture, while the shorter concave muscles are less active. This constant tension on the convex side often results in pain or discomfort, which is why you feel like stretching them, when actually they need to be contracted and shortened. Why not just side bend to shorten the long convex muscles and stretch the short concave muscles? Well, here you have a double curve pattern with a primary thoracic curve and a secondary lumbar curve. Side bend to either direction will compromise one of the curves. Secondly, passive stretch does not activate convex side or concave side muscles, so it's not effective for improving scoliosis posture. What if you just had one curve, a thoracic curve? Could you side bend, activating the muscles on the convex side? Possibly. Only if you have no adult spine modifiers or risk factors, and only if you are a competent mover. You would need to be competent enough in your movement skills to reduce the shear forces that naturally occur above and below the curves. And what about working the other side? This position clearly compromises this curve pattern. But how do you effectively work the concave muscles without compressing the concavity? Let's look at another single curve pattern. Here's a single primary thoracolumbar curve pattern, but it comes with a hypermobile lumbosacral transitional zone, which was mentioned in previous tips. This spring-resisted exercise is a great option, activating the convex muscles to expand the concavity while maintaining stability in the lumbosacral area by aligning the pelvis and ribs. And this exercise position is also effective on the other side, when activating the concave muscles in an elongated position, as long as you maintain equal distance between pelvis and ribs. Let's look at a double curve pattern with a lumbar primary curve. This becomes a bit more complex as there are now 3 areas to decompress. The client with this curve pattern is sitting in a position that exacerbates her pattern, especially at the lumbosacral junction due to the uneven pelvis. Her exercise incorporates a box to even the pelvis and a band or strap to assist with spine decompression, making it easier for her to correct her posture. Let's see a closer view. Pulling the strap down and out decompresses the spinal curves, making it easier to correct the posture by using the convex muscles to lift diagonally up and to the right for the lumbar curve, and diagonally up and to the left for the thoracic curve to expand each concavity. And, much like a pull-up, this widens and expands the ribs and activates the lats, including in the concavities. Breathe in and out, imagining your ribs are an umbrella. helps maintain the expansion. The goal is to educate the nervous system to use a minimal amount of tension to maintain expansion in daily life. Tension will create integrity of the posture, tensegrity. Stay tuned for tip number 8. Thank you.